Dr. Nattachai. Myself, Dr. Girish MS. I'm an associate professor in nephrology from Bengaluru, India. So, a hearty welcome to you, and it's my pleasure to be interviewing you here today as a pre-Congress interview session.
Hi, Dr. Girish. It is my great pleasure to have the opportunity to interview with you and the WCN team.
Thank you very much. So, in the upcoming session at WCN, you are having like two sessions. One is the annual nephrology review, and also one session on AKI biomarkers and management, which are like most of the like upcoming what we are looking at in the field of nephrology. Can you please tell us a little peek into these sessions, what you'll be going through?
For the first one, for the annual review of nephrology forums, actually we have three main topics in the field of the nephrology. The first one is talking about chronic kidney disease, focusing on diabetes kidney disease. And we will, Dr. Professor Cindy Tang will mainly discuss about the role of the SGLT2 inhibitor that's going to change the outcome and the prognosis of this important disease. And the second topic will be Professor Hamashita from Toho University, Japan, that will discuss about the role of the kidney transplant in the children population, which is really a relevant question that we all know that if this kind of the patient has been prolonged dialysis, that might overwhelm on terms of the clinical outcome. And the last one will be my presentations that I will discuss about the AKI in the tropical area, focusing in the field of in the leptospirosis, which is one of the important zoonosis and one of the important cause of tropical associated AKI. We will discuss about how to early diagnose, how to early detection complication, and also how to management, and finally also the impact of the long-term outcome of severe leptospirosis. For the second session, the AKI biomarkers, how to implement the AKI biomarker into the clinical setting to improve the AKI and RRT outcomes. I will discuss about how to use the novel AKI biomarkers such as NGAL or NephroCheck to early diagnose AKI, how to early detect the severe AKI, and how to use them to make our decision to start or initiation the RRT.
Wow, that's amazing. So you seem to be like covering the whole of nephrology in your sessions, starting from AKI, the recent developments AKI to the transplantation and diabetes, okay, whatnot. So that's really very impressive. So like looking at your all the studies you have done till now, I see that you're very much interested in that rapid response team. So rapid response. So can you just tell me in brief about that? What is it?
I think the rapid response team also very important, and it's not a new concept. It has been quite a long introduced in the field of the critical care, but in the field of nephrology, I think it's quite a new concept that we try to improve the way to early diagnose and early detection of the AKI, and this is also the novel part in terms of the nephrology role to use early detection this kind of the compromising patients.
That's really wonderful, wonderful, and a great initiative. And I think it will is in line with the ISN initiative of decreasing the AKI incidence. Thank you for all the amazing work you have done, and you have achieved so much in such a young age. So I would like you to tell something about all the nephrology people who are now just coming into nephrology. So what inspired you, and how should they keep themselves inspired?
I think the nephrology field also is one of the important field in the medicine, and also the AKI that is my main focus in the research also very important. We all know that every year we have many people who are suffering from this complication, and this is quite a global burden disease, and also especially in the setting of the limited resource. We have shown in the past that this is quite a burden disease in our countries, that we have in the ICU setting, we have more than 50% of the patient who also suffering from the AKI, and also this kind of the disease also affect to the both of the short-term and long-term outcome. So I think this is very important. That's why we try to make the collaboration, make a networking, and try to produce the registry in this region in the name of the Southeast Asian AKI study groups. And we have published many articles related to our networking.
Any words for the young nephrologists from your end?
Yes, I would like to welcome everyone to WCN 2023, and also welcome to Bangkok, Thailand. We are very pleased to have all the delegates to join the WCN 2023 in Bangkok, and we look forward to have you here.
Thank you, Professor Nattachai, for your amazing words, and hearty congratulations on being given 2 sessions in the upcoming WCN. You richly deserve it. So thank you very much for being here with us on this interview. So for all the guys out there, so here's 2 wonderful sessions. Please don't miss. One is the annual nephrology review, which is never to be missed, and also the AKI biomarkers, which is scheduled on April 1st. That would be Saturday at 2:15 p.m. So please don't miss this session, and like reap the benefits of the rich work experience that Professor Nattachai has to offer. Thank you.
Thank you, Dr. Gilish. Thank you, WCN team.
Thank you.